Welcome to Health Focus. I'm Dr. Scott, your host. November of 2017 was National Diabetes Month. That makes sense since people tend to gain weight during the holiday season. Now that we're into the new year, however, some people are fighting the battle of the bulge, trying to deal with perhaps gaining a few pounds. Of course, your weight is important for many things, including avoiding heart disease and high blood pressure. Now that the holiday season is over, many of us are trying to adopt a healthier lifestyle in this new year. And so today on Health Focus, we're going to focus on diabetes and try to get the year off to a healthy start. Today, Ann E. Lee, a registered dietitian and educator with Vallejo's own Touro University College of Osteopathic Medicine, joins us on Health Focus. Ms. Lee is diabetes program coordinator and works with people to optimize their blood sugar control through lifestyle and diet. Ms. Lee has also served as a public health nutritionist for the Nutrition Education and Obesity Prevention Program. Ann Lee received her training at the University of California at Davis, where she earned a Bachelor of Science degree in dietetics. She also holds a Master's of Education degree in nutrition from the Framingham State University. We are very honored and fortunate to have registered dietitian Ann Lee on Health Focus. Welcome, Ms. Lee, to Health Focus. We're really happy to have you here.
Thank you, Dr. Scott.
And today I'd like to start by just asking you a little bit about how you got into the field of being a dietitian and an educator.
Yeah, well, I love to eat. And so I found that, everybody has different eating habits, and they focus on different foods, and it's just always interesting to me to learn about people's eating habits. And so that's how I got into the field of dietetics and nutrition education.
Very good. And I understand that you not only teach people about dietitian-related issues and health-related issues in clinics, but also you're involved in the mobile program with Vallejo.
Right. We have a mobile diabetes education center at Touro University. And this mobile unit, it's really unique. It's 65 feet long, that's truck and trailer, and it goes to the different parts of the community to provide diabetes-related services. And so some of those services include screening for diabetes, diabetes education, and we definitely talk about food on board, so we provide a lot for the community. Anything that they want to ask that's diabetes related, they're welcome.
I think that's so important because really we want to go to people where they need our assistance, whether we're dietitians or physicians or educators, so that's so important. In fact, I believe that the National Institute of Health's National Institute for Diabetes and Digestive and Kidney Disease indicates that there may be, in fact, up to 30 million Americans with diabetes, and those numbers may be rising. Also in other countries, I know in Mexico, for example, the rate of diabetes has skyrocketed.
Yes.
So that's got to be an issue that you and your colleagues are concerned about.
Yes, absolutely, and unfortunately, there are many Americans with diabetes, like you just mentioned, and so we want to bring the diabetes education out to the community because we found that a lot of people are not really getting comprehensive education from different places, and so we have one place for them to go to that they can ask anything about diabetes.
Yes, and I think the estimates are really staggering. We're talking about perhaps 1 in 4 Americans who are either diabetic or pre-diabetic, particularly in the adult years. Right. And of course, diabetes in childhood could be due to an autoimmune process where the pancreas gets damaged by antibodies. But in adults, typically it is associated with being overweight, is it not?
Right, yeah, it is definitely. Type 1 is not preventable. And so it's not something that we want to focus on trying to get people to prevent type 1 because there's nothing they can do. Right. But with type 2 diabetes, it's very much related to their eating habits, very much related to their lifestyle. So we put a lot of focus on trying to prevent diabetes, the type 2 diabetes.
Right, and in fact, it seems that we're really almost in an epidemic here of diabetes, and some have attributed this to changing dietary habits over the years. Do you agree with that from your perspective?
Yeah, absolutely. And unfortunately, food has changed over the last few years, and our lifestyles have changed. And so, it's a combination. It's not really just the dietary changes over the years, but also the lifestyle changes. Things are a lot more easy for us these days. Just about 10 years ago, I would not be thinking about buying things on my phone. Now you can pretty much get anything over your cell phone. And so people don't even need to go shopping anymore. They can just buy something with their fingers. And so lifestyle has definitely changed a lot in the last few years, and how people prepare their food has changed as well.
Right. Not only do we not get out of our cars to open our garage doors anymore, but
Right.
we're eating a lot of food that's prepared and processed.
Absolutely.
More food that's made with corn syrup solids, for example. So
Yeah.
I could see how your work would be cut out for you. Do you have any thoughts on how we would deal with a family member or friend who's facing a new diagnosis, for example, of diabetes? Obviously, that person would see a primary care provider.
Mm-hmm.
Do you think a consultation with a dietitian might also be helpful in that setting?
Oh, absolutely. And some people might think that going to see a dietitian, it's just hearing what they know already. But that's not how an appointment works with a dietitian. When you see a dietitian, they might go over some of the basics with food and lifestyle changes. But what a dietitian does is really to evaluate each individual's needs and what they're ready to make changes to, and help them walk them through, one step at a time. So that way they would be able to reach their goal eventually. A lot of times it's very overwhelming for someone who is just diagnosed with diabetes. So they need somebody to walk them through step by step.
I guess part of that too is what we would call risk stratification. In other words, somebody who's very overweight, perhaps who also is a smoker or hypertensive, is going to really particularly need an aggressive intervention.
Yes.
Whereas somebody who perhaps is just a little overweight might need a different intervention. Is that fair to say?
Right, yeah, and most of the people with type 2 diabetes, they are at a higher risk of getting heart disease and hypertension, high blood pressure. And so it's fair when someone is diagnosed with type 2 diabetes, we automatically kind of work with them to prevent the heart disease and also prevent high blood pressure if they don't have those already.
Right. In fact, a lot of the data on that came out of the Framingham studies, and I know you were educated at Framingham,
Mm-hmm.
where they actually looked at populations and saw that these risk factors tend to add up. So we want to really address each one individually to
Right.
try to be encouraging a healthy lifestyle.
Yes,
Yes.
yes, absolutely.
And let's talk a little bit about your efforts to intervene for diet. If somebody, for example, seems to have an issue where the diet needs to be addressed, I guess you also have to look at things like the medications they're on.
Mm-hmm.
Because, for example, prednisone, which we use to treat arthritis, could raise blood sugar.
Yes.
So in a setting like that, your task is really complicated to some extent.
Right, yeah, so medications is definitely one of the things that we would consider. Not only will it raise blood sugar, a lot of the medications might actually increase appetite. So it makes a person want to eat more. So it's to being more conscious about what they're choosing to eat, how much they're eating. So it's looking at all the little factors that might have an effect on their lives to make changes there.
Okay, and perhaps Ms. Lee, you could explain a little bit about body mass index, because
Mm-hmm.
obviously we're not just looking at body weight, but we're looking also at the amount of fat in an individual's body, the adipose tissue, and how tall they are to calculate really their ideal weight.
Right.
So what is body mass index?
Yeah, so body mass index, it's a number, and it's calculated through a formula, and the number tells people how healthy your weight is for your height. And so, for example, somebody might be at a 19, body mass index, and that's falling in the normal range for the weight, for that person's height. Yeah, and to go through the ranges a little bit, between 19 and 24.9 is considered as normal range. From 25 to 29.9 is overweight, and over 30 is considered as obese. Now, these numbers are for people who are non-Asian. For people that are Asian, they do have a lower BMI range. So from 19 to about 22.9 is considered as normal weight, and then from 23 to 26.9 is overweight, and 27 or above is obese.
And these are actually very tough standards to really reach for many Americans. In fact, I believe 2/3 of Americans are overweight by these standards, so and 1/3 are obese.
Right.
So this is really a real challenge for many people here in the United States. Now, in your practice as a dietitian, are you assisting individuals both with the adult onset diabetes and the juvenile, or mainly adult onset?
Mainly adult onset, because that is the 95% of people with diabetes are the ones with the type 2 diabetes. So we do see people that have type 1, or they used to call it the juvenile onset diabetes, but you know, that's not the majority.
Right.
But we do answer questions for them if they come by. We're happy to see them.
And I imagine you have to really tailor your treatment to the specific underlying diagnosis. So for example, with type 1 diabetes, the blood sugar can be, as we call it, brittle and all over the place. Type 2, we're talking more of a general lifestyle change rather than a moment-to-moment change. If you're just joining us, our guest is registered dietitian Annie Lee of Touro University College of Osteopathic Medicine, who is our guest discussing diabetes awareness issues. As we pointed out, this is a problem that's really affecting many Americans. As many as 1 in 10 Americans are currently requiring treatment for diabetes, and some estimates suggested that number may be approaching eventually 1 in 4. So I'd like to go on to some additional questions about your approach to, for example, educating individuals. I know you brought some dietary models. Perhaps you could go through them with us.
Oh, sure. I used to love this plate a lot, just to show people how they should be eating. So let me just show you this plate. And it's a really good illustration to show people, especially those with diabetes, that vegetables or non-starchy vegetables should take up about half of the plate whenever they plan a meal. I know a lot of Americans are used to thinking protein is the main part of the meal. In fact, that's how the restaurants categorize their menu, is by the protein. You know, what is it, lamb, is it beef, is it chicken? But looking at this plate, we might need to change that mindset a little bit to have the protein as like a side dish, you know, over on the plate, and your main component of your meal should be non-starchy vegetables.
And of course, if you go to a restaurant that's trying to make a profit, like a steakhouse, the steak will be spilling off that plate. It'll be certainly far more than this. I've heard this likened to a deck of cards, the ideal amount of protein.
Right, so that's about 2 to 3 ounces.
Right.
It's like a regular sized deck of cards. I've seen cards that are a lot bigger. So, you know, like a regular sized deck of cards, it's about, you know, the size of 2 to 3 ounces of protein. So it's like this piece of fish here.
And you have here also salad, I see?
Yeah, so salad would be like a non-starchy vegetable, and not everybody likes salad, and that's okay. So if they do want to switch to something else, they could use green beans, or carrots, or broccoli, or all 3 of them to fill up that plate.
Right.
So the starch portion could be something like, you know, a tortilla, or it could be a small amount of rice, pasta, or even corn. Some people are not realizing that corn is actually a starch.
Now, Ms. Lee, do you have educational handouts that you use, or do you use a website to help convey some of this information?
Yes, absolutely. We have booklets and handouts on MOBEC, our Mobile Diabetes Education Center, that we'd love to give them out for free. And all of our services are free for the community. And so the handouts also show you, you know, what a plate would look like, what is considered as a non-starchy vegetable, and what is considered as a starch, because a lot of people get confused about you know, starches and non-starches.
And when you're going out in the MOBEC vehicle, do you go all over the community here in Vallejo?
Yeah, not just in Vallejo, but we actually go all over Solano County. So one of our biggest partners is Solano County Public Health, and so we go out to the different churches or food pantries, housing projects. We'd go to different places just to park there for a few hours, so we can provide diabetes screening and education on board.
In fact, I think we have a few photographs of the MOBEC unit. It's very impressive. It looks like you might be actually checking blood sugars at some of these locations.
Yes, absolutely. So we are checking their blood sugars to screen them for pre-diabetes or diabetes.
Is there a charge to members of the public who just want to drop by and perhaps get their blood sugar checked?
Yeah, no, there is no charge at all. We're providing this service for free.
I think this is really such an important outreach to the community, and I imagine that for the students at Touro University, it's also helpful. Do they rotate through this unit?
Yes, we definitely ask for volunteers from the medical student body to come out to the events with us. So a lot of them have some medical training, and they are happy to talk with people about preventing diabetes, and also if you have diabetes, how to maintain a good blood sugar control.
I think that Touro University School of Osteopathic Medicine is really an underappreciated resource here in the Vallejo community, and it really speaks highly to the faculty and students that they're willing to participate in this endeavor, because one thing in medicine that I think we often get carried away with is treating end-stage conditions, whereas if we could prevent a condition like diabetes through education and early intervention, that's so much preferable.
Absolutely, and the person can stay healthier longer and enjoy life longer.
And I understand that what you engage in at Touro is also referred to by some as a diabetes prevention program. So this is an organized, overarching, holistic program, is it not?
Yes, so the Diabetes Prevention Program, it's a CDC program.
Oh, I see.
And we're taking that program to offer it here in the community. So it's a partnership between public and private organizations to give this service to the community. And we are providing these classes for free as well.
That's great.
Yeah.
And lifestyle is important. So I guess you have, I understand, also some so-called coaches, lifestyle coaches. What is
Yes.
their role in this?
Yeah, so we're training lifestyle coaches so they can lead these diabetes prevention sessions. The diabetes prevention program, once you enroll, it's a year long, and they go through at least 22 classes. Or meetings, so because it's not really just the lifestyle coach teaching them, but it's more about group dynamics and group interaction, so they learn from each other. And these classes are led by the trained lifestyle coaches. So they would go through each educational topic each time, and they are trained to provide support and encouragement for the people that are enrolled in the program.
And I understand that some of these coaches actually get certified as diabetes educators?
They can. If they move on to do additional training, they can definitely become diabetes educators later on.
It's really very exciting. Are you getting much feedback from the community in terms of whether people feel that this has helped them in their lives?
Yes, a lot of them come by and they tell us that they don't really get this service anywhere else, or sometimes they have questions they're not sure where to ask, so we are the resource. They can definitely contact us if they have any questions about diabetes.
And do you also network with doctors who are located more in the clinical setting, for example, at Touro and the Touro clinics?
Yes, we definitely recruit some of our diabetes prevention program participants from the doctors that are in the area. So they can refer their patients to us if they have newly diagnosed somebody with prediabetes.
And in terms of the community, obviously when it comes to diet, we're looking, for example, at specific foods, but Vallejo is a very multicultural community, and I imagine dietary preferences vary from person to person, so that must be something you have to be sensitive to. You mentioned body mass index in Asian populations. There also are dietary preferences in certain populations, are there not?
Yes, absolutely. And sometimes it's not the population itself as well, it's the personal preferences. We might have someone who's not Chinese and love Chinese food. And so it's really a personal preference that we really have to spend some time to talk to them and get to find out what this person likes to eat and then go from there.
I think one of the challenges we have in the United States is that, for example, we're developing a kind of general American cultural preference for very high-fat, processed, salty foods. And some of that is something that might need to evolve over time, because dietary preferences can change over time, can they not?
Yes.
And
yes.
for example, I know some food preparation companies are putting a little less salt in prepared foods, which is good for those with hypertension.
Right.
And if we could get away from some of the sugary drinks, that would also be very helpful.
Yes.
So how do we get there, Anne?
I know, huh? It takes a long time.
Yeah.
And sometimes I explain to people that, changing your dietary habits, it's like, learning a new musical instrument. It takes a lot of practice, and you might need a coach or a teacher to kind of help you through one step at a time. You may need to practice every single day, and maybe after a few years, you will get there and master that skill. Some people might master it a little sooner, and some people might take a longer time, and that's okay.
Right.
Everybody goes at their own pace. So we're there to help them, to kind of guide them through, each one day at a time.
Some changes too may take a generation for a society to adopt. For example, we've known since 1964, since the first Surgeon General's report, that cigarette smoking causes lung cancer. But it took 30 years before cigarette smoking was really socially not as prevalent as it was before. So maybe with sugary foods and high-fat foods, we're looking at a similar process.
Yes, hopefully we will see that soon. That people will know that there are other options out there that are healthier and it can still taste good. And hopefully we'll see that.
Absolutely. If you're just joining us, our guest is registered dietitian Ann Lee, who is with us from Touro University School of Osteopathic Medicine. And this subject is really so important, getting into the issue of diabetes and how to prevent it through a holistic approach involving diet, which is the area of expertise of Ms. Lee, and also exercise. But unfortunately, we only have so much time and it's hard to cover all of it, so we're just scratching the surface. But I would just like to indicate again that I think the medical literature suggests that you really have to treat everything. You can't just, for example, treat somebody's diet but not talk about exercise.
Correct.
Or not talk about smoking, or not talk about high blood pressure.
Yes.
And I think you probably would agree with that. I think we're on the same page.
There's
there.
not a simple solution, so we have to work on it from different aspects.
And speaking of simple solutions, one of the things that I've found as a practicing physician is that so-called diets just don't work.
Right.
And what I found, and perhaps you can address this, is that nobody could really stay on a diet forever. So if you go on some diet like the Pritikin diet, or a high-fat diet, or a low-fat diet, or an extreme low-calorie diet, you might lose a tremendous amount of weight, but eventually you're going to get tired of it and the weight will come back. That's my impression. Perhaps you can share your opinion as an expert on diet.
Yeah, so it's more about changing the lifestyle. Like you said, it's not really just focusing on a diet, but everyone eats a certain diet. It could be a regular diet, it could be a low-fat diet, but it's a matter of trying to figure out what works for you best to achieve what you want to do.
Do you have any clients or patients who may fail initially but succeed with multiple efforts?
Absolutely. It's like quitting smoking, right?
Okay,
they might try a couple of times and they quit, and then they go back, and then they might try to quit again, so they might have to try multiple times in order to find out what really works for them. So we just have to keep encouraging them to not give up. Right. Try this, try that, one day at a time, and hopefully eventually they will find out what works for them best.
Keep trying. And if you're just joining us, again, we're with Ann Lee, a registered dietitian from Touro University, discussing obesity and diabetes. In our last few minutes, because we're down just to about 3 minutes, food labels. Do you find that most people can interpret and read food labels? Do you have any advice on that?
Yeah, food labels is a complicated issue, and they're trying to give you a lot of information about that food through food labels, and that's why it's very overwhelming for some people, especially if they're trying to learn to read it. So the simplest advice that I can give people is, if you're looking at a food label, try to think about what you're trying to get from that food. So for example, if you're looking at bread and they have a food label And when I look at bread, I would focus on the fiber. I want to get more fiber from the bread. So I'll try to look at the fiber content for the different types of bread to see which one might be higher, and I'll go with that, that product.
As we close out our limited time on this enormously complicated subject, are there any additional resources that people can go to at Touro or elsewhere to pursue this further if they want to learn more about accessing dietary expertise from someone such as yourself?
Yeah, absolutely. So if you want to find out where we are at for the Mobile Diabetes Education Center, our website is tu.edu/MOBEC, MOBEC. And just, our calendar's on there. You'll know where we're at in Solano County. There's also the eatright.org, which is the Academy for Nutrition and Dietetics website. So you'll find a lot of food-related information on there. And also the American Diabetes Association would have a lot of information for you.
Well, registered dietitian and expert educator Ann Lee, it's certainly been our privilege to have you on Health Focus. We've only scratched the surface of this issue, but we've been trying to address diabetes and really how to address it through both diet and lifestyle changes, really. Right. And at this point, I'd just like to again say that I think this has been an informative half hour. I wish we had more time, but I hope sometime you'll come back and join us again.
Well, thank you for having me.
And thank you for all the good work you do and for all the good work that Touro does here in the community.
Yeah, thank you, Dr. Scott.
And remember that here at Health Focus, we always focus on your health. So we hope that this has been helpful to you. I'd like to thank all of you for joining us, and we look forward to seeing you again very soon. Have a great day.